These are the bowel sounds which we can heard through auscultation with the stethoscope. First one, we can see that through auscultation, if the bowel sounds are absent for 5 minutes, then it may indicate peritonitis. It is the inflammation of the membrane lining the abdominal wall and covering the abdominal organ. Second one is hypoactive. If one bowel sound for 3 to 5 minutes, then it may indicate constipation. Third is normal bowel sounds. 5 to 30 bowel sounds per minute is normal. Then there is normal bowel movement. And last one is hyperactive. That is more than 30 bowel sounds per minute. It indicates diarrhea.